Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Hey guys, welcome to another episode of Civilian Medical Podcast. We're on episode 22 now. Hard to believe, but we've made it that far. No one's kicked us off the air yet. My name's Dietrich. I'm skinny medic down here in the south with 1,000% humidity. Sean's over there in Colorado with like 0 humidity. So I'm sweating. Sean's not sweating. Kind of a change of pace for us.
Yeah, it was 94 degrees when I walked outside today, or 90, 94, something like that. And I was like, wow, this is actually really completely pleasant. I feel like hanging out outside for a little while.
God, I'm so jealous.
Yeah, it's so great. Although the nosebleeds kind of make up for what we lack in humidity. So
you can just use a tampon for that. Just shove it up your nose. It's fine.
That's what I heard. I read that somewhere. It's totally fine. We have a guest today, Dietrich. Who is it?
Yeah, so we have Mark with Off-Grid Medic, and I think this is going to be a little bit different subject than what we normally talk about. You know, we normally are talking about, plan A, what we're going to do, and this is how we're going to do it. But Mark brings a kind of different spin on things about how to do it, some wilderness medicine, maybe some improvised medicine we're going to take a look at. So I think it would be great for our listeners to listen up and see what Mark brings to the table.
Welcome to the show, Mark. First off, what's Off-Grid Medic?
Hey guys, Sean, Dietrich, I really appreciate the opportunity to be able to get in on this and to share some great information. Off-Grid Medic is a company that I started about 4 years ago. I have a very strong background in emergency pre-hospital medicine, both in the military and also in the civilian world. And after about 20 years or so of just doing internal politics with pre-hospital medicine, I really felt that draw to get back into education. So I actually started up a company called Off-Grid Medic Llc. And what we do is we actually travel the country and we teach programs in wilderness first aid, wilderness first responder, and also wilderness medic upgrade classes. It's funny that you mentioned Colorado earlier, Sean, because about 3 weeks ago, I was actually just outside of Cripple Creek, Colorado, teaching at 10,000 feet, and it was 42 degrees in the morning with a high of 70. And I was like, oh yeah, this is the bomb right here. So, but
it's so glorious. Were you there with Colorado Mountain Man? I believe that's the name of the guy.
Yep, sure was. Yep, that's Jason Marsteiner out there. Yeah, one of the really neat things about that particular program that we do is that there's nothing like learning about the physiological effects of altitude while you're actually experiencing those effects at altitude.
So, yeah, I can imagine, man. Up there, I've played hockey up there in Victor, Colorado, which is even a little bit higher than Cripple Creek, and it's pretty nuts. You take about 2 steps and you think you're going to die.
Exactly. I always try to get out there about 4 to 5 days before class starts, so that I can become acclimated. As the instructor, I have been told that if I were to be severely affected, that all of my gear would be equally distributed amongst the students before anyone even tried to render aid. So
that sounds fair. That's mountain rules.
But yeah, I mean, we travel the country, and what we actually teach is it is a deeper understanding of what medical problems actually are. Our programs are not quote unquote checklist type programs. They are not programs of if this do this, if this do this type programs. We actually try to teach a deeper understanding of what the body is doing and why the body is doing it. Because if you have that deeper understanding, then you can actually anticipate or be able to predict what the body's response should be to a treatment or to an intervention. and actually get ahead of the curve that way.
So while we're talking about altitude, like what are some of the symptoms of altitude sickness, just for some of our listeners?
Okay, so there's basically three different categories, if you will, and everything is directly related to the altitude that you're at. So starting around 6,000 feet or so. And again, these are approximate numbers because these numbers are different for everyone. Dietrich, you and I could go to Colorado Springs, which is at 6,000 feet. I could have no negative effects, and you could actually come down with a condition called acute mountain sickness. AMS, or acute mountain sickness, is basically, I like to describe it as the worst hangover you've ever had in your life. You just can't get it out of first gear. You're dehydrated, and it's very easy to get dehydrated at altitude. But you're dehydrated. You just can't get out of first gear. You end up with insomnia. You end up with some very vivid dreams, actually. And yeah, I mean, it's literally a case where climbing a flight of stairs, you'll actually have to stop at the top of the stairs and wait.
Mm-hmm.
So that usually kicks in around 6,000 feet. You jump up to about 8,500, 9,000 feet, and you can end up with a condition called HAPE, H-A-P-E, which stands for high altitude pulmonary edema. Edema, of course, is just a fancy medical term for swelling. So what happens there is as you increase altitude, you decrease pressure. So since there's not as much pressure actually pushing on the tissues within the body, then they tend to swell. As a result of that, you can actually end up with a fluid buildup in the lungs, and that's where HAPE comes from. Mm-hmm. The treatment for that is pretty straightforward. Get them some oxygen if it's available, and rapid descent. And surprisingly enough, even a descent of only 500 to 1,000 feet can actually make all the symptoms go away. The physiology is just absolutely remarkable. You get up past about 11,000 feet, and you can actually encounter a condition called HACE, H-A-C, which stands for high altitude cerebral edema. So if any of your listeners are familiar with any of the vital signs for Cushing's triad or for increased intracranial pressure, again, with that increase in altitude, we end up with a decrease in pressure. The brain only has the ability to swell in one direction as long as the skull is intact, and that happens to put pressure right on the brainstem. So you can actually end up with the same presentation of a closed head injury just from gaining altitude too quickly above 11,000 feet. Treatment for that, exactly the same thing. Let's get them some O's, and let's drop altitude ASAP.
Very cool. I appreciate it. Yeah, I thought that was just like while we're talking about it, just to make sure we're all on the same page. Yeah. So, wilderness medicine, like what is that for us? Like where is that going to Walmart, or is that going to, out in the woods? Like what are you thinking there? Is this, a 30-minute hike, a one-day hike? What do we need to be prepared for?
It's one of those terms that I think really gets thrown around a lot without a full understanding of what it is and what it means. I think to a lot of people, there's this mental image there of, the shaman or the medicine man or somebody who's trying to heal the injured or the ill, using plants off the landscape and unconventional medical treatments and things like that. Even though that sounds a little far-fetched, there actually is a little bit of truth to that. From an academic standpoint, the term wilderness medicine simply covers medical treatments that are delivered whenever you're separated from definitive care, and that's hospital-level care, by either time, distance, or circumstance. The National Institutes of Health has actually gone and further defined wilderness medicine as the remote and improvised care of patients with either routine or exotic illnesses or trauma using limited resources and manpower with a delayed evacuation to definitive care. And whenever we talk about these treatments, this can go anywhere from, classic first aid type treatments all the way up to advanced skills like wound closures, reducing dislocations, practicing preventative measures, oxygen administration, creating a rescue plan, etc. In traditional street side emergency medicine, we operate within what's referred to as the golden hour. And that is actually defined as the time of onset from a traumatic injury or sudden illness until arrival at definitive care, again, hospital level care. And that first 60 minutes is what we refer to as the golden hour. Statistical studies have shown that when patients receive care at hospital level definitive care treatment within 60 minutes, that their outcomes tend to be better. Wilderness medicine actually way exceeds that time frame. We can actually go up to hours, days, or even weeks. So that kind of covers that time portion, if you will, out of that time, distance, or circumstance. As far as distance, here in the United States, we're actually pretty lucky. About 95% of our inhabited areas, you can be at a hospital within about 60 minutes or so. While I was serving as an EMS director for a rural service down in Middle Georgia, our nearest hospital, which was actually a community level hospital, was still 38 miles away. So we actually quite often had patient care encounters that went well outside of that golden hour. Thank goodness we had a medical control physician who was very open to giving us latitude and letting us do a lot of pilot programs and whatnot.
Yeah, like for me, I my service, we have patients that may take us 45 minutes to an hour just to get to, and then that's a couple hours back down. So right. Thinking about people who are out hiking, maybe they're just day hiking, things like that, what are some supplies that you think that may be useful for them to carry? And I know that weight comes into an issue there too. They'd love to carry the kitchen sink, but they can't carry a lot of weight stuff too.
Yeah, it does. I have had a lot of people ask me, Mark, what do you carry in your medical kit? And I just kind of grin and I'm like, kind of a simple question, but it's got a kind of a complex, situationally dependent answer. If I'm working the streets, my medical kit is about $250,000 worth of high-tech equipment and, supplies and pharmaceuticals that's inside a big metal box with some blinky lights on it going down the road. If I'm operating as a contract medical provider, everything fits inside a StatPack's G3 medical pack. If me personally, if I'm just going out into the woods for, a week or so, which is actually fairly common for me, everything really fits inside of a Ziploc bag. I have taken a very long, detailed look at similarities and the differences in everything from, tactical bags to contractor bags to ambulances to kits that you can buy online, of course, at your site. Kits that you can go to Walmart and pick up if you really want to gamble with your life. And whenever I looked at what these kits had in common, in medicine, we try to keep things simple because things things will go from normal to off the scale crazy in about 2.2 seconds sometimes. And in that craziness, we tend to fall back on our training. So we actually use a lot of acronyms. The traditional acronym for pre-hospital care has always been ABC, right? Airway, breathing, circulation. For the practical side, it was CAB for a while. Now it's been changed to March. And for wilderness medicine, we actually go ABCDE. And that stands for airway, breathing, circulation, disability, and environment. And if we really think about it, these are things that are inside our primary survey. These are our immediate life threats. So if I am putting together a kit for myself, what I want to do is I want to make sure that no matter what I'm carrying, that I can handle conditions that, or I can handle complications that involve airway, breathing, circulation, disability, and environment. One of the biggest concerns in wilderness medicine is actually the environment. We don't see a lot of hypo or hyperthermic patients street side. We don't see a lot of patients who are overheated, who are suffering from exertional hyponatremia street side. However, back in the woods, these things are actually really, really common. And once you learn what those signs and symptoms are, and once you learn how to treat them, then all of a sudden you can kind of make some kit adjustments and go from there. I'm a firm believer that the more you know, the less you have to carry. But having said that, too, why do we have to have $250,000 worth of equipment and supplies on an ambulance? Because the expectation is there that we are going to deliver a baby at 8 o'clock in the morning. We are going to shut down the interstate and land 2 helicopters at noon. We are going to work a cardiac arrest at 3 o'clock in the afternoon. And then we're going to get about 2 hours of sleep before we go and we save a choking baby. Mm-hmm. So a lot of that comes with the expectation. Why is a tactical medical bag so heavy on hemorrhage control? Because hemorrhage control is expected in that environment. So if you take that mindset, if you will, and kind of step back, there are a lot of questions that I will ask myself as I'm putting together a kit, and I have multiple kits. But as I'm putting together a kit, I'm asking myself, who is going to be with me? What is their level of training? Do they have any medical problems or medical issues or medication that I may need to know about? For example, do they have an EpiPen? The last time that I want to hear I need my EpiPen is when we're 3 miles from the vehicles up by the falls up in the mountains. Yeah. So it's kind of the term kit mentality. I actually really like that term because your kit is constantly evolving because it's situationally specific, it's seasonally specific, and it also depends on who else is going to be with you and what the level of activity is going to be.
It sounds like there's so much, when you say wilderness medicine, there's so much that goes kind of along with that. And like you just described, seasonal, situational, who's with you, all those other things. I have a feeling, and it even says in the show notes, that there's going to be a lot of other skills and abilities that you would need to be successful in any kind of WFA, WFR, or wilderness medicine. What would you say those skills and abilities would be for someone to practice and become proficient in?
Well, I think that everything has to start with a solid base. Whether that is an educational base, whether that's knowledge that's been picked up through workshops, through classes, programs, etc. But keep in mind that medicine and acceptable medical procedures often change. Think about something as simple as the evolution of the tourniquet. 15, 20 years ago, we were never to put a tourniquet on pre-hospital. That's just the way. That's just the way the culture was. Nowadays, if you're riding around without one, to me, you're at a significant disadvantage. But
Definitely. I think even, when I started EMS, 10, 15 years ago, that was definitely, you're right. It was a last resort. And now
yeah,
everyone has a tourniquet, it seems like, or more people are starting to get into that. So,
exactly, exactly. So that's just on the tourniquet side. Now for allergic reactions, they're actually giving other antihistamines, which happen to include certain antacids like Nexium, um, for allergic reactions.
yeah, like
Guidelines.
Zantac is getting used a good bit just because it does really good with like the hives part of the
Yeah,
reaction, stuff like that. So it has to do with the H receptors, like the beta, H1, H2 receptors. I don't have to
correct.
get too much in
Yeah.
AMP, but yep, you're absolutely right. Like Benadryl works on one receptor, and then the
Mhm.
antacids actually work on other receptors inside the body.
Mhm. And the main takeaway from this is that what, medicine changes, the guidelines change, and the only way to really maintain that solid educational base is just by staying current with your training. So, number one, that solid and really ever expanding knowledge base. Even the guidelines for CPR changes every 2-3 years. Every time I teach a class, I'll always get that one person that says, "Wait a minute, aren't we supposed to do this?" And I'm like, "Well, we don't do that anymore. That was changed."
Yeah.
So yeah, that solid base for sure. The next thing I would say is probably just general camping skills. Understanding what the different mechanisms are out in the wilderness that can take you out of the game. They are completely different than here on the street side environment. The ability to spot widowmakers, and just to clarify, a widowmaker is not a big hairy spider. It is a hanging tree branch. It is a rock that's hanging, right on the edge of a cliff. That is not the place that you want to hang out and make your camp at. Things like knife and fire safety. Knowing how to act in bear country. Understanding, changing weather patterns. Weather, again, that goes back to that environmental component whenever it comes to wilderness medicine. Understanding hazardous animals and plants. I know a lot of people who are very allergic to poison ivy. And whenever you get them outside, they don't know what it looks like. They just know that I was in that and now I'm itching like crazy. Because
Yeah, I'm one of those people. I feel like I can we'll get within 10 feet of it, and I'm going to start itching.
Yeah, So we've got that ever expanding knowledge base. We've got those general camping skills, and then this is where we really kind of start to get into the meat and potatoes here. We're actually talking about incorporating some wilderness survival skills in with our medical training. What we're talking about here, fire, water, shelter, orienteering skills. If you look at the majority of search and rescue calls, if you look at the majority of people who actually get in trouble out in the wilderness, it is because either A, they became injured, or B, they became disoriented and ended up truly lost. So if you can learn to manage those two aspects of your activity, then it really gives you a leg up as far as improving your chances of coming back home in just as good a shape as you left in.
Yeah, I mean, you talk about bringing, water, stuff like that. Yeah, when I go in, we do our search and rescue team. Like I have 3 liters of water on my back when we start out. Still have the ability to start fire. Have a couple different ways to start a fire, and then I take a water filter with me. That way, if some reason I run out of water, if I need to share my water, then we can create more clean water.
Sure. And one of the main questions that I always like to ask is, if you have to stay with a patient for an extended period of time, do you have the skills to be able to maintain your own well-being in addition to the patient's well-being? Can you develop and execute a plan? Can you accomplish everything that needs to be done by using your gear as well as the patient's gear? And really, it's kind of like a fancy mathematical equation where the value of X is never known because you really never know what your patient could be carrying. You don't know if your patient has a fully stocked med kit or if they have nothing at all. So you actually have to go in assuming that the value of X is 0. But, I am big on challenging myself, especially whenever it comes to this particular training point, if you will. Back in 2010, I actually went through Dave Canterbury's Advanced Pathfinder training school. That was a 5-day program, and I learned so much about myself. It wasn't even funny. We were, as part of the training for that program, we were actually restricted to 32 ounces of water every day. And I think over maybe the first 4 days, I may have consumed 300 calories. But understanding how your own mental processes slow down and how your protective instincts and your judgment starts to fail when you're truly dehydrated or when you're really operating off of those caloric reserves. To me, that's gold right there, because it is so hard to predict how you're going to act when you're dehydrated. But if you've been dehydrated and truly experienced it, and when I say dehydrated, I'm talking about for multiple days at a time. From a physiological standpoint, it was really, really an eye opener for me.
Yeah, I would definitely be hangry at 300 calories a day.
Yeah, it was. There's a saying in the survival community. Number one, survival is a lazy man's game. Okay, if you don't have to stand, sit, and if you don't have to sit, lay down. Every single picture of me from that program, I am laying down in the pine straw. Because literally, it takes so much more calories just to maintain a standing position than it does a lying position. And even though I was doing everything that I could, over that 5-day period, I think I still lost like 6 pounds. I mean, it was really, really cool. So
well, you had me at survival is a lazy man's game, because I am way down.
Sean's like, I think I can survive this now.
I got this. Here I thought I knew nothing. I'm ready.
I hear you, buddy. I hear you. I need to get you and Jason together out there. We will test your theory. How's that sound?
Perfect. It sounds terrible.
All right. So
circling back to equipment and stuff like that, I know you got some show notes. There's some stuff that something that you don't want to improvise. We can talk about improvised medicine all I want to, but what are some things that maybe you take with you that you don't want to necessarily improvise?
I know how to. I know how to make a really good improvised tourniquet, but if I have to improvise a tourniquet, I'm way behind the 8 ball. From a mathematical standpoint, I can do the math, and I can show you that within 60 seconds you can actually be dry. And so the tourniquet is one thing that I will always carry. And my current tourniquet of choice is the RevMedix Parabelt. I wear one every day. It is a multifunctional piece of equipment, and I'm all about multifunctional gear as well.
Yeah, I just did a review on that belt on my YouTube channel.
It is a fantastic piece of equipment, and RevMedix has been an absolute dream to work with. What are your thoughts on their TX2 and TX3 feature?
So yes, I have their TX2 and the TX3 tourniquets, and I like them a lot. I think the ratcheting mechanism is something that I wasn't completely sold on to begin with, to be honest with you. But then once started talking to some more people who've used them and started looking at some of the data behind it, I like it. We've actually incorporated our stuff because I think it's a little bit, especially the TX3 is a wider tourniquet.
Yep.
So I think it's going to be less painful than some of the other tourniquets that are on the market. So I don't know that necessarily replaces my cat, but it's a great brother or sister to go along with my cat. So I can use them both in different circumstances. But I like it. And like you said, I like the parabelt. A lot of people say they can't EDC medical gear, which, I would tend to argue that as well. But at least you can carry
I will argue with that all day long. Yeah.
But the belt, you can take it off as long as your pants fit. Like on the video, some of the comments were about that. They're like, "Oh my gosh, how are my pants going to stay up? I take my belt off." But my pants fit even with a gun tucked inside the waistband, so I'm able to take my belt off. My pants don't hit my ankles. But to have that as an extra tourniquet, I think is great. So it's a good solid belt. The tourniquet's solid, so I like it. Yeah.
There is another product out there. It is from a fairly new company. It's called Dermaclip. It is a non-surgical wound closure. It was developed. I want to say it was developed 6-7 years ago as a replacement for sutures during or after a cesarean section. And it worked so well that plastic surgeons started to pick them up. And now they're actually making several different varieties and sizes of them. You may have seen one of their product videos out there. I talked to the VP of the company maybe 4 or 5 months ago, and he said that their social media investment budget was $0. They did one product video, put it out on their own website. It went viral, and they were sitting worldwide right at 100 million views of their product video. But this is the one that almost looks like an extra wide butterfly, but it has the little tie wrap or the zip tie looking pieces on the side of it.
Yep.
Those work absolutely fantastic. They really do.
I've talked to a couple of doctors who use it for orthopedic stuff. Yep.
So they are currently only available by prescription. But we got some samples in and really ran them through some pretty intense testing. According to the VP of their company, there is an over-the-counter version that's supposed to be coming out later this year. Whenever those hit the streets, I think that's really going to be a game changer. I do. But go ahead.
We definitely talked about those, and I think actually when we talked about them in the episode that we said, wilderness, kind of being outdoors and being away from primary care would be a great use for these, great use case.
Yeah, the ones I saw, I don't remember the name of them now right offhand, but they were on Amazon for like $25 a pack, something like that. Ish. Okay. And they were the same thing, like they're a nice big butterfly. They had like zip ties that had little notches in so you could pull them tight. I don't remember the name of them right offhand, but yeah. So I think something like that because I'm not a huge fan of sutures. I think sutures is a skill that's it's a perishing skill. If you don't use it all the time, you're going to lose it. You don't know when to suture something closed. You're going to get infection, nasty stuff in there. But this is a great way to do that. And so I think that product is something for viewers to take a look at. And it's kind of expensive, but if it could save your butt from going to get sutures, then maybe it's not so expensive.
Yeah, the one we talked about was called Zip Stitch, actually.
Yes, thank you.
Yeah, that's what it was.
Zip Stitch. Yeah,
that's why I keep you around, John.
There are just about every woofer and WEMT program that I teach. I always know, man, are we going to learn to suture? And I'm like, man, do you really know how much crap you have to carry to be able to do that? And the one thing that we can't replace out there is a sterile field. And you want to go suturing stuff up and putting additional holes in the skin and everything out. Let's just, there are certain wounds that you really should not close in the field. One of those happens to be animal bites. The risk of infection is just way too high. But let's say I'm on a kayaking trip and I've got, I have one more day to go until I get to the launch, and the yak swamps, and I end up ripping my knee open. Am I going to close something like that so that I can finish up the next 24 hours? Absolutely. And really, that's where a product like the Zip Stitch, or a product like the Dermaclip, or even an improvised version that you can make with duct tape and the inner strand of 550 cord, and whatever it takes. But the focus, at least in my opinion, the focus should be on an external wound closure versus an internal wound closure. Or
I agree with that. We can fix anything with duct tape.
Exactly. Yeah, for real.
I love it. Hey, going back to skills and abilities for wilderness medicine, I think we left off on improvised stuff.
Yeah. One of the real hallmarks of wilderness medicine is learning how to provide medical treatments without having access to, a big, fully stocked medical kit. We can splint with sticks. We can construct an improvised litter. We can make our own rehydration salts. I can make a cervical collar using water bottles, duct tape, a closed seal foam sleeping pad. You really, really get the opportunity to get creative there. At Off Grid Medic, we routinely train students who are already medical professionals. We had one program in particular. We actually had a physician's assistant who had been a PO for 30 plus years, and we had an anesthesiologist that was in the program as well. And during the Saturday night exercise, they actually came up to me and they said, "Mark, we are completely out of our element." And I'm like, "Docs, what are you talking about? You guys have been doing this for years." And they're like, "Yeah, but we are used to a well-lit environment that's sterile, where we have communication, where we have plenty of equipment, we have plenty of supplies, we have imaging equipment. It's a climate-controlled environment. We can even open up a cabinet and bring you a warm blanket." And I just kind of grinned, and I was like, welcome to wilderness medicine.
Mm-hmm.
You don't have, just because you don't have that stuff out there, though, your patient still needs your help. And the patient assessment and the patient care really doesn't change that much. Patient assessment is still patient assessment. We still use our hands to palpate the body. The skin color, temperature, moisture are still a vital sign. Capillary refill time is still the poor man's blood pressure. The patient's needs don't change. You just have to dig a little bit deeper and really step outside the box regarding your interventions. If we have a patient who, let's say we have a patient who is shock addicted, and we don't have access to intravenous fluid, what do we do?
I would still, if they're able to drink water, so let's just start trying to rehydrate them. Keep them warm. Maybe have them lay supine on the ground, lay them flat on the ground.
And as long as we don't have any ICP going on, as long as we don't have any abdominal trauma going on, let's go ahead and elevate the feet just a little bit to maintain that perfusion to the brain, right?
Yeah, we can do that.
And what we just described are what your options are out there. The only thing that we're doing is we're actually taking away that $250,000 big medical kit on wheels. But the treatments are still the same. As long as we can understand, as long as we can teach people why they're doing what they're doing and why the body is presenting in a certain fashion, then once the students understand why they're doing something, that's when you really start to see the magic happen. That's when they finally start to get that aha moment and you see the light bulb go off.
The next thing we have in our show notes is about medicine plants, and for me, like, I admit I am super weak on this. I've taken a couple classes. My wife has as well. We do a show here locally, and Alan he won the show Alone on Discovery Channel. He does a walking plants and he just like walks by and see weeds and like, oh yeah, you can use a dandelion for this, this, and this. And
Yep.
so I'm extremely weak on that kind of medicine part of it. So maybe we can talk about that just for a minute.
Yeah. Well, first of all, Alan is an awesome guy. I've known Alan for years. He and I have actually trained together and whatnot. Fantastic dude. But yeah, I mean, having a firm understanding of what medicinal plants are available in your area is a very solid skill to develop. And if you'll notice, I use that term to develop. I don't say to learn, because things change with the seasons. It takes a long time to actually learn them, but to develop those skills kind of insinuates that it is continual learning. It's continual improvement, if you will. You know, yes, we can make aspirin from willow bark. We can use cattail. We can use honey as an antibiotic ointment. We can use plantain to make a poultice for insect bites, for certain skin issues. Even though I'm not a botanist, and I will go on record saying that, there are a couple of really big ones that are super easy to identify that are pretty harmless. Cattail is one of them. Plantain, you probably have plantain growing in your front yard and you don't even recognize it. Willow is another one, although you do have to be a little bit careful with willow, because it does prevent the platelets from sticking together. So, it's one of those skills that I don't think you ever really master. You just continue to add to it.
So oh, sorry, go ahead.
No, but so if we take those 5 areas, if you will, to really be good at wilderness medicine, you've got to have that solid and ever expanding base. You've got to have those general camping skills. You really need to become as proficient as you can at quote unquote wilderness survival skills. Practice and think your way through problems and develop that ability to be able to improvise medical care using whatever is available. And and then at that point I would add plants in.
I agree with that, and I've always said that, because you think about essential oils and stuff like that. Like, I think there's probably a good mixture in there. Like, I don't foresee essential oils being the cure-all, fix-all, but I think they have their place. So if you can mix good commercial grade first aid items, as long as with natural medicine and essential oils, things like that, then I think that's a good mixture of things for people to understand.
I would very, very, very much agree with that statement. Yeah, I do not think that it is an end-all fix-all, but I do think that it does have a place in modern medicine.
Yeah, there was an oil, and it totally slipped my mind right now, and Candace would fuss at me, but there was oil, like, we were talking about, like, tooth, like, dental emergencies and stuff like that, and I put it on my finger, and, like, my whole face and, like, through my neck went numb, and I was like, holy cow.
That was either peppermint or clove oil, one of the
Clove
two.
oil, that's what it was. It was clove oil. And, like, that's the kind of the thing that's like, all right, this would be a cool thing. Do I think it's, like I said, it's not a fix, but if you didn't have oral gel, you didn't have the commercial stuff, that is perfect. Like, it worked great. For your dental emergency, you couldn't get to the dentist till tomorrow, or if it's a Saturday or Sunday, it's going to just something get you through the weekend. Absolutely. I think it worked great for something like that.
Oh yeah, definitely. And if thinking back even 60, 70 years, you actually went to a pharmacist to get your drugs made. And if you go back another 20, 30 years before that, you had a traveling pharmacist, you had a traveling doctor, you had a traveling apothecary. And where do you think that they got all of their supplies from? They got them off the landscape, So, I very much agree that nature is the original pharmacy, but whenever you're dealing with medicinal plants, keep in mind that the concentrations are significantly different than what the refined, quote unquote, store-bought products are. The mechanism is the same, but the dosage is going to be different. Quite often, it takes repeated doses to equal one pill, if you will. So, it is a tool to have in your toolbox.
And no, I'm gonna end up chewing on some like poison ivy or something like that. That would just be the way I would getting screwed on the deal.
What about which mushrooms make you forget about your injuries? Do you cover that?
So let me tell you my thoughts about mushrooms and plants really in general. Every mushroom and every plant is edible once.
Yeah. They would just tax it like in Colorado. They're just gonna tax the heck out of it.
Yeah.
yeah. No kidding. I was just out there, and there was actually a lot of talk about that. So,
yeah, absolutely. How much does one of these courses cost? It sounds like it's really involved. It sounds like there's a lot of time, effort, and energy that gets put into it. Like, what can someone expect if they want to go take one?
Our 16-hour WA program. So that's our wilderness first aid program. Depending on where in the United States it is, because obviously we do have to cover our travel expenses and everything. But you can go anywhere between 120 up to about 200 for the whole 16-hour 2-day program.
Oh man, that's actually quite a bargain.
Yeah,
I mean, it's we want to get this information out there to the people, and we don't want to. We are the only company that's traveling the nation doing this, and we're also the only company that does not have a single PowerPoint slide in its presentation. Every bit of our stuff is done outside all the time. I'm a firm believer that you cannot learn about an environment unless you're exposed to that environment. I can sit here and I can talk all day long about the effects of altitude. When you encounter those effects for the first time, it reinforces the learning. So how can we talk about things like conduction, radiation, evaporation, for gaining and losing heat and moisture, if the students aren't experiencing that as part of the learning process? So yeah, for our WFA, again, we're talking about what part of the country it's being offered in, what time of the year, but yeah, somewhere in the $120 to $200 range for that. So,
in my opinion, that's absolutely a good price.
Oh, it's a pretty sweet program. It's extremely comprehensive, and I mean, just to kind of give you an idea of what the curriculum's like. We always do some basic anatomy and physiology, because unless you have a really basic understanding of what the body considers normal, then you have no idea what abnormalities to actually look for. So a little bit of A&P in there, some patient assessment skills. We go through bleeding control, recognizing treating soft tissue injuries, bone injuries, splinting, sprain strains, head spinal burns, thermal, shock, of course. So really that covers all of your traumatic stuff. And then we also talk about medical emergencies in the backcountry, because guess what? Our population is getting older. Our population, even though they're getting older, they're also becoming more active. We are starting to see people in their 60s and 70s that are out doing multiple day hikes. And a lot of them, they think that their abilities are higher than what they are, or they overexert themselves and all of a sudden they become hypoglycemic on the trail, or they left their nitroglycerin in the truck, or fill in the blank. So medical emergencies, knowing how to handle those in the backcountry is just as important, if not more important, than it is street side, because we don't always have the ability to call 911 and have 911 tell the caller what to do before EMS gets there. So you are truly on your own, So all of the trauma stuff, the medical emergencies as well, and then some environmental considerations. Bites, stings, envenomations. Those are huge. Medical kit mentality. We have a whole section on that because a kit that I put together for me, you may open it and go, I don't recognize any of this. and to me, a medical kit is about as individual as a quote unquote survival kit. Now, are there some commonalities there? Absolutely. We still have to be concerned with airway, breathing, circulation, disability, and environment. But as long as we cover those 5 areas, the actual products or the actual methods that you choose to fill those in, you use whatever works for you.
It's like when I opened up Sean's kit that time, and all I had was whiskey and duct tape and a couple of tampons. I was like, I don't even recognize any of this stuff. What is this stuff?
Yeah, I caught you, and I was like, that's all you ever need.
Is that like, do you even medical, bro?
Yeah. My patch says medic, kinda.
Ish. I saw the medic ish patch. Like, I definitely want that patch.
They're so good.
I like that. But
Mark,
so, our WFA, we normally run that on a Saturday, Sunday. We've got one coming up. I think we've got one coming up 3rd week of next month down in Clinton, South Carolina. And then I'm also working on some programs out in Arkansas and also up in the Adirondacks. And then, of course, we'll be going back out to Colorado again in July of next year. That has now become a yearly thing. So because I will take elevation and cold temperatures over oppressive southern heat any day.
Negative, sir. I do not like cold weather. I do not do. Sean and I were talking about that last episode. I do not do cold weather. So I will come to Colorado, but I want it to be like 80, 75, 80 degrees. Like, I want it to be nice there.
In Colorado, man, 46 degrees is shorts weather.
Yeah, through that. Yeah.
We'll see. Let's see if I can get out there, and I'll bring Mrs. Skinny Medic out there, and we'll come hang out with you.
Yeah, let's do it, man. Mark, where can people find out about your classes and sign up for classes and just keep up with all the stuff you're doing out there?
Well, this is where that wonderful thing called social media comes into play. You can follow us on Instagram. You can follow us on Facebook as well. You can also go directly to the website, which is www.offgridmedic.com. And, it's on our website, you can actually look at, you can go and flip through the photo gallery. There are a lot of pictures that I really don't want to put on there because I don't want to scare people off. But our moulage skills and the realism of the training that we're doing is absolutely phenomenal. In fact, in Colorado, we actually had a Marine veteran. He was an above the knee amputee. The students had no idea that this guy was even at the school. He literally snuck in, and in I don't know, maybe 15 minutes after dark, there was a tragic chainsaw accident with multiple patients. And whenever they got there, here's the patient laying there with an amputated leg. And his severed portion of his leg was laying about 5 or 6 feet away from him. And again, everything was moulaged up. We had active arterial bleeding, and it was just awesome. It's just really awesome.
That's cool.
Yeah. Looks great.
I think you kind of have to have a sixth sense of humor, to be able to do this. But the main message that I would like for the listeners to really take home is, imagine what you can learn to do without having your EDC medical kit. And, we actually did a program for a church in downtown Atlanta. It was a custom program, very, very rough part of town. They called us, they expressed their concerns. I went down there, I did a needs assessment for them, put together a program for not only their missionary staff for whenever they go overseas, but also put together an active shooter plan for them as well. To the best of my knowledge, it is the only church where there is a fully stocked trauma pack with tourniquets hanging all over the outside of it that is actually behind the pulpit in front of the pastor as he delivers his sermon.
Nice. That's pretty cool.
Yeah. So there's actually one there. There's one on each wing to the right and left, and then there's another one over in the nursery as well. So, you don't have to be out in the wilderness to end up over your head. You don't
Absolutely.
don't have to be out in the wilderness to go, crap, if I only had my bag, I could do this. Well, guess what? You don't have your bag, so you have to learn to make do with what you have.
Yeah, we talked about that. Our last episode we recorded was, talking about the El Paso shooting and how, ways to improvise, pressure bandages, tourniquets like that, just the stuff you can find at Walmart and stuff like that. So
yeah, exactly.
Awesome. Well, I appreciate you coming on. Is there anything else you'd like to add before we say goodbye?
No, just I would like to thank both of you guys for actually putting this stuff together. We are in a changing world, and people who don't think that they need these skills, all it takes is one event, and by the time you realize that you need them and you don't have them, it's actually too late. I'm not trying to spread fear. What I'm trying to do is build confidence. I'm actually a very humble person, but I'm a very confident person because I have tested and I continue to test and hone my own abilities. And just knowing that I know what to do in these type of situations is just such a confidence builder.
Yeah, for sure, man. All right, guys, thanks for listening. Go check out Medical Gear Outfitters and use coupon code Civilian Medical for any medical supplies that you need. Again, that was Mark from Off Grid Medic. Thanks so much for being with us. And as always, we will talk to you all next week.
Find us and subscribe at civmedical.com.